Hi, we're here gathered to talk about the Mayo Clinic Travel and Tropical Medicine Clinic. We're a comprehensive clinic that provides individual care to patients who are traveling to international locations. We're very unique in some ways. We see families together. We provide very updated travel advice to travelers who may be traveling to any part of the world. The advice is updated based on what CDC recommends, WHO recommends, as well as numerous other international organizations. The other part of why we are unique is that we provide post-travel evaluation for people who may come back sick with a disease that they may have picked up when they are traveling. I have two of my colleagues here from our clinic, Donna Springer, who's our clinical nurse specialist, and Dr. Phil Fischer, who's a pediatrician in our travel clinic as well. And so I would like to turn to Donna and ask her about her experience with the travelers that she has seen in the clinic.
Well, one of the comments that a number of my patients will say to me is that when they come, they're expecting just to get vaccines. And when they get not only the recommended vaccines, depending on where they're traveling to and their medical history, will update any routine vaccines that they may need just for being at home. But they're really surprised when they not only get the vaccines, but also helpful tips to stay healthy, information and prescriptions for malaria prevention, travelers' diarrhea prevention and self-treatment, and they're really pleased and pleasantly surprised when they get all of this in just kind of a one-stop shop at one visit.
Phil, do you want to tell us a little bit about children traveling and what kind of problems they get into when they travel?
Hopefully they don't get into any problems.
Yes, hopefully they don't.
But in fact, there are over 1 million American children leaving this country every year to visit other countries. And some of them are at risk of getting into troubles. So it's good that we can offer to see families together to take care of infants, children, adolescents, and adults all together based on their individual health needs, but also on what's going on for them as a family with their particular itinerary. Kids are a little bit different than adults. They can use medicines differently. There are different risks of different diseases. So we need to give them specific care to help them as they go. And for kids as well as for adults, one of the big issues that people don't always expect coming into the clinic is we need to talk about safety to make sure they can stay safe while they're traveling.
The other thing that I just wanted to talk a little bit about was in terms of our post-travel evaluations. So it may be that somebody has immigrated to the United States from a country that has a disease that's not commonly present in the U.S. And we do have expertise within our clinic to evaluate and manage those patients. We do that within our clinic amongst ourselves so that we can provide the most thought out care for that patient, but we also collaborate with other specialties within the Mayo Clinic, whether we're talking about radiology or we're talking about other subspecialties, including surgery and others. And so I think that's the other very unique part of the Mayo Travel and Tropical Medicine Clinic.
For my pre-travel patients, one of the things that has been very helpful for the patient coming to our clinic at Mayo Clinic here is that if our traveler has some pre-existing illness, for example, this week I had an oncology patient who was wanting to travel and spoke with the travel doctor in clinic to just kind of review certain immunocompromised issues that would be pertinent to that patient. And then we actually even called the oncologist in the clinic at Mayo here that was working and treating that patient. And so it really is a comprehensive approach that we provide to the patient, which I think is certainly a benefit for them.
So Donna, since there may be travelers who've never been to our travel clinic before, I was just wondering if you want to tell people what to expect when they come to an appointment.
Well, sure. Well, first of all, to get an appointment, you can just call and make the appointment yourself. You don't have to have your physician refer you or recommend that you go. And once the appointment is made, The traveler, when they arrive, will be asked to complete just a basic health history and travel information history. Some of the most important things to have with you to your appointment is your immunization records, your travel itinerary, and certainly any medicines you're taking or any pertinent health condition you might have. And then once the traveler is brought back to the exam room, we have presentation, video, so to speak, that they watch that gives them some basic information that anyone traveling should have understood and be aware of. Then the provider, whether it's myself as an advanced practice nurse or the physician, will go in and review things, their medical history, where they're going, provide recommendations related to vaccines that would be helpful for them. If they're going to a malaria risk area, we would talk about malaria prevention medicines. They'd obtain the prescription. If not, we would still talk about mosquito avoidance measures, which is quite important in any tropical country. We talk lots about diarrhea and how to prevent it and how to self-treat if it happens. And then just basic traveler health information could be as simple as blood clot prevention, deep vein thrombosis on a long air travel, and how to prevent that. And ultimately then, if there are any vaccines that are recommended, they're administered before the patient leaves so that they don't have to travel elsewhere to get their vaccines or their prescriptions.
How many people are we seeing as a clinic here every year?
We've actually looked at our volumes in our clinic over the last few years. We see about 2,000 to about 2,700 patients a year. As a collective group, we've had, a lot of research and added to the literature and knowledge of travel medicine.